think you're right. It is sort of a chicken and egg type story about whether it's hypertension that's causing this or the nosebleed leads to hypertension.
Are you done?
Oh, I like my camera better. Yeah, just
Yes, you do, but you don't have it, do you?
no, but I have yours.
Let me wash my paws here.
Doctor that washes his
My
hands,
glasses.
always respected. Sure.
Thank you.
Well, that was pretty cool. Your nose on TV. Okay.
Did you get to see?
No.
Oh man!
You will.
I'll take a look in your ears if I grab a little bit different one.
Yeah, stick it in your ear, Greg. Wait, what was this? Read between the lines?
No, just see if you can see a shadow on the wall.
How many fingers is that you're holding up? I can see.
It's Bugs Bunny.
Alright. Had to open up really wide if I could. Lift up your tongue. Great.
Smile, Greg. You're supposed to be having a good time.
Just to be enjoying
I'm
this,
still
right?
on camera.
You're still on? She's still on camera? She
Yeah.
loves you.
I know.
No, I love YouTube.
She's wide awake now. She was real sleepy a while.
No, I'm not wide awake. I'm so flaky.
Give her that
Just-
camera, man. She'll. Okay. The tent peg down the middle of your nose is your
Yes.
septum. There looks like there's some scab tissue on your septum on your left side. There's no active bleeding in that area.
Okay.
I think what we would like to do would be to try to see if we can, number one, get the blood pressure under control.
Okay.
There's some things we can do. Right now, I could cauterize that area. And by that I mean, taking a little silver nitrate up in that area and chemically cauterizing it to
Okay.
stop any bleeding. But that hurts. And I'm not sure if you need that or not. The second thing that we could do is that we could treat you conservatively, and that's by using salt water sprays in your nose
Okay.
and emollients at nighttime. Emollient is something like Vaseline or something in that area.
Okay.
We have both at home.
What has he been using at nighttime? The other thing is, do you have a vaporizer or humidifier at home too?
No, I can get one.
Okay. Can you see Dr. Carlson have you seen him about high blood pressure at all or not?
Every time I've seen Dr. Carlson, my blood pressure's been normal.
Okay. Were you in a lot of pain when you had the bleeds?
I
Or was
was
it just really nervous?
really frustrated. I've always been able to get him to stop in 5 minutes.
Oh, he was hungry.
And I was hungry.
Okay.
And I just ran
And
up
I
the
had
stairs.
cooked.
How do you stop your nosebleed?
Either pressure or a small piece of Kleenex under the lip.
Okay.
And the lip and
The
teeth.
best way to stop your nosebleeds, I know where that area is. It's on your septum, right up front.
Yeah.
Grab your nose like a clothespin
Mm-hmm.
and to hold it together with both fingers and to hold it for about 5 minutes and then let go. I mean, are you on any aspirin or any Motrin?
I take aspirin for arthritis and headaches.
How often are you on aspirin?
I took 3 last week, 2 on Monday and 1 on Tuesday.
Okay.
And it's
Aspirin, as you know, thins your
Yeah.
blood and it's going to make your nose bleed more. My feeling would be, if it's possible, to use other things like Tylenol for your arthritis. Probably doesn't help that much.
no.
But if we can avoid the aspirin, that would help from the nosebleed point of view too. I'd probably like to, could I have you see Dr. Carlson just to make sure about the blood pressure?
Sure.
She'll probably give you something to do serial blood pressures with. So even, to come in periodically just to check off in the morning, get some blood pressures over a period of several days.
Okay.
Because that's really high. I mean, that's scary high.
Yeah.
And you have no history of heart disease. You told me you're adopted.
Yeah.
Okay, no real history of heart disease. No recent nasal trauma.
No.
I haven't hit him in years.
No, she hasn't.
I think He needs a good hit every now and then.
Oh, God, no.
What I'll do, what I'd like to do is I'll let Dr. Carlson know that I saw you here today. I'll dictate up a letter to her and send that to her. What we'll do is to see you back again, if I could, maybe in about 3 to 4 weeks. I want to make sure this is healed all on the side of the nose. If you're having more bloody nose difficulties, what I'll do is cauterize that area. But several things again. Number 1, no nose picking. That's always number 1. Number 2 is lay off the aspirin. No aspirin. Number 3 is to use the Vaseline in your nose at nighttime, and you know how to pinch your nose. The last thing is to use the saltwater sprays.
Yeah, I learned how to take care of my nosebleeds before I could read. And I mean that literally. I had them when I was 3 and 4 years old.
Yeah, but you're 55 and things have changed.
I've had practice.
Well, see, now if we forget the doctor's directions,
Yeah,
They're right here, man.
they're right here.
They also have some hearing loss too.
A little.
Tell me a little bit
A
about
little?
Talk to Mama about that.
Well, you can talk to her, but
What?
some hearing loss in my left ear. Found that I augment my hearing with a little bit of lip reading.
When was the last time you had a hearing test?
About 5 years ago.
Okay, what we may do is when I see you back here next time, I want to make sure this nose is taken care of. We'll probably get an audiogram with you too. We'll set you up here. All right.